This is a crazy situation for our business. There's a nice aspect of it.
So if you are diagnosed, we can in an instant find all of the smartphones.
You're putting other people at risk of coming into contact with that.
Hi everyone, I'm Jennifer in New York.
And I'm Kurumi in Tokyo.
Believe it or not, it's May 1st, 2020.
And here's Quick Takes wrap of the pandemic this week.
Non-essential businesses have started reopening in the U.S. Despite this, many Americans still largely depend on brave delivery workers to get their food to wherever they may be in lockdown.
En crisis está, pero yo tengo que poder trabajar para poder comer, para pagar mis apartamentos. Me llamo Humberto, soy de El Salvador. Que murió un amigo que murió, pero que en paz descanse donde quiera que esté, ¿no? Gracias a Dios, no estamos bien aquí en el país donde estamos y tenemos que seguir trabajando.
Thank you. Thank you.
My name is Gary Clegg, and I'm one of the owners of Allison Restaurant. Being a delivery boy is not an easy job. For deliveries at this restaurant, it has skyrocketed as we're only open for takeout and deliveries.
Me llamo Juan, hago 20, 25 deliveries al día.
There are different protocols for protecting themselves.
A veces le dejamos afuera o a veces le damos a los clientes.
Oh, thank you.
Me lavo las manos constantemente, pongo mucha alcohol, la mascarilla la tengo siempre.
Wow, this is a crazy situation for our business. There's a nice aspect of it.
Están buenos los tips, ya, están buenos. 10, 15, 20.
$42.
It makes me excited for the guys. There have been so many moments of positivity.
All right, here for the nurses.
Our restaurant is located near a major hospital, Mount Sinai, so a lot of our customers are medical professionals.
En el futuro yo espero que vengan cosas buenas, que no esté preocupado de lo que está pasando ahorita.
Next, we head to Iceland, where one company has been working to create a more accurate picture of the spread of COVID-19.
Today we're off to Iceland, one of my favorite countries, which has been at the very leading edge of the coronavirus testing. There's a company there called Decode Genetics, which has been looking at the Icelandic population's genomes for about 25 years. When the virus hit, they very quickly started testing just about everyone they could, not just people who are sick, but a random sampling of Icelanders. They've come up with some of the biggest insights we have on the virus. Let's head to Iceland and talk to the CEO of Decode Genetics.
My name is Kári Stefánsson, and I'm the founder and CEO of Decode Genetics. We started to screen in the population in general on March the 13th. And we have already screened about 10% of the population. We have determined that on average, during this time that we have been screening, about 0.8% of the population has been infected by the virus, but that number has been coming down. We have sequenced the virus from every single person infected, and that has generated a very interesting picture. So if you look worldwide, there is a tremendous collection of mutations in this virus. So in these patterns of mutations, you have a barcode, and having the sequence of the virus from everyone infected gives us an opportunity to determine the country of origin of the infection in all of the infected in Iceland. Another thing that you can do with the sequence is that you can use it to trace the infection in Iceland. You can figure out who was infected from whom. So if you are diagnosed with an infection, we can in an instant find all of the smartphones that were within 1 or 2 meters of your smartphone over the past 5 days, which is somewhat scary.
Yeah.
Because it sounds like considerable invasion of privacy.
Yeah.
But when you are looking a beast like this in the eyes, you have to use whatever you have.
You know, because Iceland is relatively contained because you were so aggressive with your testing and tracing. I mean, you didn't go onto the same lockdown as some of the other countries. Explain to me what lockdown looked like a month ago and what it looks like now as a result of all the testing that you've been able to do and all the tracing.
We really don't have a lockdown.
Yeah.
We don't have a curfew. We have the ban on gathering of more than 20 people. We are insisting that we should keep a social distance of 2 meters. We have our elementary schools are open, the childcare centers are open, the stores are open. We are taking a very mild approach to this in general, but we have been very aggressive when it comes to the specific approach to those infected and been very aggressive in looking for them by screening widely. I think that the societal price for doing this approach is much less. There's a higher price in screening, but that's trivial. That's absolutely trivial.
It was just a few weeks ago that President Trump first promoted the drug hydroxychloroquine as a potential cure for COVID-19.
A drug called chloroquine, and some people would add to it hydroxychloroquine. And I think it's going to be very exciting. I think it could be a game changer, and maybe not.
The French study behind those claims has since been widely criticized, and you've probably realized so have several other medical studies that have followed at a rapid pace in the past few weeks. So what can we believe? Because there's so much confusion about this virus, I think a lot of people look to science and research for some clarity. Maybe some of these studies that come out are a little bit premature. Talk to us about that.
One of the really complicated and interesting things that's been happening through this outbreak is that because we're dealing with a virus that we really don't know a lot about, there has been this amazing response from the science and research community to go out there and learn as much as they can, as fast as they can. And one of the things that usually happens in a normal time is a process called peer review. And right now we're in an environment because of the desire to learn as much as we can about the virus. We're seeing the process that science usually has happen behind closed doors is being played out in real time. And so it's just a messier and more confusing environment for people to read about, for people to formulate policy on, and I'm sure to do research in as well.
And we're also paying so much attention to the data points. In the past few days, we've really seen this phrase, excess mortality. Can you explain to us what that is?
At the very start, you're just looking to identify cases. You're trying to figure out who is infected. As a disease like this becomes more of a global pandemic, you need to start thinking about it from the standpoint of how does this affect things like life expectancy? How does it affect global total deaths? When we look at baseline mortality and excess mortality, essentially it's a way of measuring how much extra death is there as it relates to previous years, and knowing that this virus is going to be one of the factors that goes in there, but so are a lot of other indirect effects because of it. For example, a stroke victim who can't get an ambulance in time, and they may be dying of something else, but it's related to the situation caused by the virus.
What should we, the public, be paying attention to?
One of the dynamics that's been really interesting to watch as attention is focused on this over the last 4 months has been people kind of move from the stat of the week. At first it was cases, and then it was ICU admissions. And well, what we really need to look at is, testing per capita or deaths per capita or cases per capita. Excess mortality seems to be this week's flavor. This is a really complicated outbreak. You're going to need a whole bunch of different benchmarks to understand it. correctly. And each one is going to tell you different things. None of them is perfect. The best way to understand is to be able to look at all of those and try to read smart people and not latch onto one particular metric or another as the thing that's going to tell you where this is heading.
If you've been putting on gloves when you leave the house to protect yourself, we want to make sure you know how to take them off safely. Take a look.
We're supposed to be staying at home as much as possible, but when we do venture out, a lot of us are taking some extra precautions like wearing masks or gloves. But if you don't know how to correctly use these items, you could be unintentionally putting yourself at more risk. So I'm going to show you how to properly wear and discard your gloves. While wearing your gloves, assume they have touched the virus. I like to think of this virus like honey. Once you touch it, you have to wash your hands to get it off. So just assume that your gloves are covered in honey. You don't want to touch your face, your clothes, or any other part of your body while you have the gloves on. Also, avoid touching anything you may touch later on with your bare hands, like your phone. Number 3, take them off cautiously. The key is to not touch your skin while you're taking the gloves off. The CDC step-by-step guide recommends starting by grasping the outside of one glove at the wrist. Peel the glove away from your body, pulling it inside out. Peel off glove number 2 by sliding your fingers inside the glove at the top of your wrist. Turn your second glove inside out while pulling it off, which should leave the first glove inside the second. Number 4, dispose of them properly. Gloves are flooding parking lots and roads across the country. Don't contribute to our climate crisis while getting rid of your gloves. Throw them away in a trash can like an adult. And lastly, as we cannot say this enough, wash your hands again after you take your gloves off. And remember, throughout this whole process, don't touch your face. Now I'm going to check in with my colleague John Lauerman about best practices for gloves. Why are some health officials telling people that wearing the gloves could be more dangerous than having nothing on their hands at all?
The gloves are supposed to prevent you from contaminating yourself. So if you think you're going to touch yourself on the face with the glove is potentially contaminated, so you've defeated the purpose of the glove. If you are using gloves and you discard them in an irresponsible way, then you're putting other people at risk of coming into contact with that. So it's up to all of us to try to dispose of these materials, masks, gloves, bleach, whatever it is, appropriately, so that we don't increase the risks for other people. We're all in this together.
Ain't no mountain high enough, ain't no valley low enough, ain't no river wide enough to keep me away.
Apple and Google said this month they were teaming up to make it possible for iPhones and Android phones to alert their owners if they think they've been in close proximity with someone who later tested positive for COVID-19. It's called contact tracing, and for the two tech companies it's become a bit of a controversial endeavor. Both firms insist that privacy is preserved and no personal information ever leaves an individual's phone, but critics question the privacy concerns and also whether the tech will even work effectively at all. Here's how Apple and Google say it should work. Let's say there are two individuals standing in line at a grocery store. We'll call them Taylor and Meredith. They've never met before and they never speak while they're in the store. While they're in there, Taylor's iPhone generates a string of random letters and numbers called an identifier. Meredith's Android phone generates one too. The Bluetooth chips in each of their phones can tell if they come in close proximity with each other without needing internet or GPS or Wi-Fi or anything that could transfer personal information. It's a little bit like when you buy a new pair of wireless headphones and you turn your phone on and you turn the headphones on and they can at least see each other. So Meredith and Taylor's Bluetooth chips have detected each other and exchanged their random identifiers. A few minutes later, both devices generate brand new identifiers, and their owners leave the store still having never spoken. Those identifiers stay on their phones for now, so not only are they nonsensical strings of digits, they're also only stored locally. But let's say a few days later, Meredith is positively tested for COVID-19. She downloads her local government's public health authority app and tells it about the diagnosis in order to get the latest medical advice. What Apple and Google are creating is a way for that app, and specifically only that app, to also ask Meredith's permission to give a contact tracing server the random identifier numbers that her phone's generated over the past few days. Just those numbers, that's it. So Meredith agrees. The next day, Taylor's at home eating the food she bought from the grocery store. That moment, Taylor's phone detects that there's an identifier on the server that matches one it's seen before in person. A bit like watching a televised lottery result, where the random numbers drawn on screen match the ones in a person's hand on their ticket, hopefully. The numbers mean nothing in and of themselves, of course, but because there's a match, that means something specific. Taylor's phone has at some point recently been near a person who's tested positive for COVID-19. If Taylor also has the Public Health Authority's app, her phone can tell the app a match has occurred, and then the app can alert her and offer the latest medical advice. The app never sees the random identifier that the phone's matched, it just knows that a match has been found. It'll be up to each of us to choose whether we opt into the contact tracing system in order to find out. For Quick Take in London, I'm Nate Lanxon.
काठमाडौँ पहिले भन्दा अहिले धेरै नै सफा छ, क्लियर छ।
यहाँ हाम्रो अहिले चाहिँ यो काठमाडौँतिर चाहिँ पहिला भन्दा अहिले त छ्याङछ्याङदी देखिरहेछ, राम्रो छ हैन, वातावरण राम्रो छ। के रे जतातता हिँड्दाखेरि नि अहिले चाहिँ राम्रै लागिरहेछ हामीलाई चाहिँ हैन। लकडाउन भयो पनि के रे पहिला त धुलो उड्थ्यो, अहिले चाहिँ छैन, हिमालतिर छ्याङछ्याङदी देखिरहेछ हाम्रो, राम्रै छ।
हावा स्वच्छ जग्गा आउँदाखेरि यहाँ हावा पहिले भन्दा धेरै स्वच्छ छ। मान्छे कम भयो, एउटा अब त्यो गाडी साडी कम भयो, पोल्युसन कम भएर हावा त धेरै स्वच्छै छ, हरियाली छ। काठमाडौँ हेर्दाखेरि नि सफा सबै देखिन्छ। पछि लकडाउन खुलेपछि यस्तै होला जस्तो हैन, तर मेन कुरो त अब गाडीहरू कम गर्नु पर्यो हैन। गाडी चाहिँ नि अब सबभन्दा कम गर्नु, यो गाडी त धेरै भयो यहाँ त, जहाँ पनि जाम गाडीले गर्दा नि बढी पोल्युसन हुने हो। बस्ती पनि धेरै भयो यहाँ, धेरै त्यो पनि अलि कन्ट्रोल गर्नुपर्छ त्यसमा। त्यस्तो भयो भने पछि पनि यस्तै होला है जस्तो हुन्थ्यो नि सर, यस्तै भएर अब सधैँ त्यस्तै हुँदैन। फेरि अब पछि गाडी चलेपछि खोलेपछि त हैन, गाडीले गर्दा नि बढी पोल्युसन हुने हो। फेरि खोलेपछि त पछि त्यस्तै होला जस्तो छ, त सधैँ यस्तै भयो त राम्रै हो।
So it's a big challenge to maintain the air quality at the moment once the lockdown will be released. Since it's a capital, so higher mobility will be there. And we also need to think of like very seriously about the pedestrian movement, no? So instead of the vehicular movement, so we have to think of like, the pedestrian movement, because the social distancing, the physical distancing is very much required. So the government policy decision and an action plan is going to contribute to sustain and retain the environmental impact that we are experiencing. So that's a big challenge.
वातावरण भनेको त अब स्वास्थ्य राम्रो जसलाई पनि है, मान्छे सबैलाई सकेसम्म सबैले चाहिँ यसमा हेल्प गरेर वातावरण स्वच्छ नै गर्नुपर्छ हामीले।
I think it's the biggest irony of my career that we're in the middle of a pandemic, but we're struggling to keep staff paid and keep the doors open.
A lot of hospitals in the U.S. have been in dire financial straits for a while now. We know that at least 30 hospitals entered bankruptcy last year alone.
What this has helped people realize is even hospitals may not be there if we don't take care to help them be there.
I everyone, I'm Sarah Ponczek and I am a markets reporter with Bloomberg News. So I'm sure you've been hearing the word recession a lot lately, and this past week we got confirmation that we are indeed in one. So first, what actually is a recession? Because you can debate the parameters all you want, but a textbook definition would tell you that a recession is 2 consecutive quarters in which you see a decline in GDP growth. Well, this past week, we did get GDP data, or gross domestic product, for the first quarter, and it dropped 4.8%. That was just a little bit more than what economists were expecting. They had forecast a drop of 4%. So a decline in GDP was not all that surprising. However, the components of the report were really interesting, and we got insight on consumer behavior at the start of the shutdown. So the GDP report, when you get that data, you also get something called personal consumption. So in plain English, that is personal spending. Now that part of the report is divided into a few components: goods and services. And within goods, you have non-durable goods and also durable goods. So I will start with services. Services are things that you spend money on that you can't touch. They are intangible. Well, spending on the services side of the economy dropped 10%. Particularly, spending on healthcare services dropped too. Think about it this way. Many elective surgeries aren't happening. You also might not be opting to go to the dentist right now. So that is money that is not being spent on services. So in the goods side of the economy, we actually saw spending only drop a little bit more than 1 percentage point. But that was because what's called non-durable goods actually rose. So non-durable goods are things that go by pretty quickly. You go through them relatively quickly. So all that money you've been spending on toilet paper at the supermarket or food, also hand sanitizer, that fits into this category. Now, spending on goods though, goods are things that last longer, like spending on a car. Well, that did see a nice decline. However, this really is just the tip of the iceberg. Economists say that in the second quarter, on average, we should expect to see a decline in GDP of 26%. That's because the current quarter that we are in is the one that is really being affected most by this coronavirus shutdown. The most dire prediction calls for a decline of 65% in GDP. Now, for a comparison, back in 2008 during the financial crisis, the worst we ever saw was a decline of 8%.
All right, that wraps things up for us this week. But remember, you can get all of your coronavirus news from Quick Take 24/7 on Twitter, Instagram, Facebook, and YouTube.
And for a daily recap of the day's top stories, subscribe to our newsletter. Thanks for watching. We'll see you next week.